So it was that thinking where you could actually combine two careers at the same time. And that was quite interesting because it wasn't a case where it had to be this or that. But what if you could have both? Like maybe something you want to be professionally good at and something you have a passion for, having to have them together while also making an impact. So I think that perspective really changed how I see things, and that gave me a different perspective to what I wanted to do. My name is Dr. Fauwzia Sanusi. I'm a medical doctor. I'm working in public health. I work in Nigeria currently with as a technical assistant to Director General of one of the largest primary healthcare boards. Having to work in that, I could see that on my own end, I was trying to make a career change. So I was trying to see where I could make larger impact. It was something that I was not sure if I should, if I shouldn't, because it was a career leap I wanted to make. It was going to be something a bit different from what I typically do. And that's quite scary, kind of having to know if that's a leap I should take or if I should consider something else. Um, what I did was first actually see where I could make the most impact, and I came across effective altruism, which was very interested in terms of what they do, the impacts, and how they've made those impacts in different areas. I saw that there was a particular area of public health, which was very interesting to me, and that's how I found HIMED. There were quite a number of things that HiMed offered. For example, it was the one-on-one call that you could have, which was particularly interesting. So the career course. The one-on-one provided more insights and it was so informative and very good. And the person I spoke to, Simon, recommended I should actually join the course. It would be very good, especially career-wise for me in terms of choosing what I want to do. So the first was the diverse group. We diverse in terms of where we at in life. We had someone that was a medical student, someone that was a doctor in some very special niche specialty training. And we had someone that has been practicing for more than 20 years. So each person brought the unique perspective in terms of their experience, where they were at, the advice, because you would maybe have conversations on something and someone would say something and you'd be like, oh wow, that's quite mind blowing. Not thought of it that way. And that unique perspective that everyone brings actually made such a huge difference in terms of how I thought about quite a number of things. Then there was also the weighted model, which was interesting. And as someone that sometimes struggle in terms of making decisions on how particularly was the best course. Using the weighted model was quite interesting because it was very specific and targeted. Someone on the group used the weighted model, but also had a combination of course of carriers. So it was that thinking where you could actually combine two carriers at the same time. And that was quite interesting because it wasn't a case where it had to be this or that. But what if you could have both? Like maybe something you want to be professionally good at and something you have a passion for, having to have them together while also making an impact. So I think that perspective really changed how I see things, and that gave me a different perspective to what I wanted to do. I was quite scared and I communicated that to the group. And, someone just said, yes, but that's okay. When you start something, it's scary. A year down the line, a few months down the line, it's not scary anymore. That was quite motivational amongst other conversations I've had with other people. When I started the course, I wasn't sure in terms of what I could offer others. It was more of a case, okay, maybe I need help myself. But that's something I also learned that from at any place, you could also help others. And it's just realizing that I actually have a lot of experience and lots of knowledge. I could always, based on my experience, providing some sort of guidance or just conversation on it. We had a medical student on our group, and I wished I had his shoes. And that's because I wished I got a different perspective to just being a doctor. Imagine if I was exposed to that as early on as early on. I think that would have made a huge difference for me. And that's also something that's making me consider mentorship personally. Also giving them opportunities of networking for them where they could actually experience that. And it's okay if, for example, they experience that and they don't want it, but it's also having the options, which would be great. So yes, I'll be interested after a year, after two, after five.